Hello and welcome to Healthcare Voices, where we bring you authentic voices behind healthcare innovation and impact. I'm your host, Katharine Cummings, former clinician turned healthcare technology advocate. And today I have the privilege of speaking with Jamla Rizek, international speaker, digital storyteller, and advocate for reshaping disaster nursing and healthcare communication. As the section editor for the Journal of Emergency Disaster Nursing, she curates cutting edge research that transforms frontline experiences into effective disaster response strategies. With extensive clinical expertise, Jemla elevates nurses' voices, challenges systemic issues like burnout, and champions equitable care for marginalized communities through her blog, Adventures with Nurse Jamla. Her work inspires healthcare professionals to embrace resiliency, empathy, and innovative approaches in addressing today's complex healthcare crises. Thank you so much, Jemla, for joining us on the podcast today. I'm so excited to talk to you.
Katharine, thanks for the opportunity.
So, Jemla, to kick things off, I would love for you to share with our listeners what initially inspired you to pursue a career in healthcare, and how did those early experiences shape who you are today and what you do today?
My family is immigrants. And so for me, I grew up understanding how limited access to resources affects the individual and their family. I remember my family going overseas and not having access to, resources that they need, such as seeing a physician, seeing a clinician of any sort, or any specialty care. And that truly impacted their livelihood. And so for me, growing up, seeing this really championed my vision and my goal to make sure that others don't experience the same things that my family did. And I will say that if it wasn't for my mom, who really brought to life some of these challenges, I probably wouldn't have been as passionate or as advocating for as much as I do now.
That's really an amazing story, so impactful. I think so many of us go into healthcare wanting to be an advocate for people who are marginalized, whether we ourselves are marginalized or we see it kind of in our community. So very, very powerful story. Thank you for sharing that. So social media is a really powerful tool for healthcare education and healthcare information in general. How have you used social media or social media platforms, specifically regards to your website, Adventures with Jemla, to foster community engagement and spread kind of health awareness in general?
Adventures with Nurse Jamla started years ago when I had the opportunity to actually be a volunteer for the Olympics in Brazil. And I loved the chance to share my experiences by caring for, incredible athletes from all over the world and truly understanding if a disaster did happen or if there are communication issues. How do we, as clinicians, when none of us know each other or even speak the same language, be able to provide care for them? And so this is where Adventures with Nurse Jamla began. And since then, my goal is really to kind of bridge that gap between healthcare professionals and the communities they serve. So through social media, I try to share evidence-based education, disaster preparedness tips, and really advocacy efforts for marginalized populations. I truly think that if we engage with others and have resources on social media that are reputable and evidence-based, that's going to be the best way to highlight some of these opportunities that people may not be aware of. And so through this platform, I really try to highlight some of those global pressing issues, foster awareness, and provide information, for example, to populations such as pediatrics and their caregivers on how to address what's happening in the world. What are some resources that maybe they need? Not just them, but also as nurses and clinicians as well. And I think that that is one of the things that I hope that with this platform and with this voice, I'm able to share that information with those from all over the world. And that's what I've been able to do thus far. But there's still more countries and more people to meet.
So I see on your website that you post, almost daily, I feel like. It's a big lift, I think, to provide so much evidence-based information in a really understandable and consumable way. What are some of the things that you do to, kind of stay up to date on the things that are going on and provide that daily insight?
One of the ways that I try to stay updated is by belonging to professional nursing organizations. I think that's extremely invaluable. And I know that I speak for the ones that I belong to, that the information that they provide can help so many as long as it's shared. And
Mhm.
so for me, I belong to the Pediatric Disaster Coalition, American Nurses Association, or the Emergency Nurses Association. And those are just a few that put out sessions as far as training, as far as educational opportunities or resources. So it's not like we have to go fishing for this information. It's already available by these organizations. We just have to take it and spread it. And that is one of the things that I do, especially as it pertains to pediatrics and vulnerable communities or marginalized communities. I take the emails that I get and then I ask for permission, and they are more than willing to have me share this so that others can continue to share it so that message gets shared with everybody. We don't gatekeep. We don't like to work in silos. And so when that information is available, I try to push it out, which is why, as you mentioned, Katharine, there's more sometimes than one post a day. Because if something is happening in the world, I want to share that resource so that people that are triggered or affected by it have the tools at their ready.
Well, it's really incredible how many times you post. I don't know how you do it. You're truly incredible in that regard. So I appreciate you kind of spreading all of that awareness and making sure that your community that you're posting to has all that information. I think along the same lines of that, patient advocacy is very tied to allowing patients or communities to have access to information, especially those marginalized groups. And I see that as really a recurring theme in your work, is that advocacy for those groups. How do you ensure that the voices of those groups, in particular marginalized groups, pediatrics, are heard and integrated into the care process, or just integrated into like international thinking, right?
I think as healthcare providers, we have to recognize that advocacy starts with awareness and then it extends to action. So I have to be aware that this issue is happening. Because if I am not listening to what's happening or acknowledging what is happening, I'm not going to be able to provide any action or, stand alongside others to collaborate and, work interoperably as to what we can do collectively. So I think one of the biggest issues that I see is we often tend to speak generically in a broad sense without truly engaging those individuals that are experiencing these challenges. There are individuals in our communities that don't speak English, that have health issues that they are afraid to get health care for because they may not understand what the provider is saying to them. We also have individuals that come from other countries, for example, and they don't understand that, going to the healthcare provider is a good thing, that it's okay. Whereas in some countries, it's a luxury. And so I think for us, advocacy again starts with that awareness, recognizing that these issues are happening, and then what can we do to support those individuals within our community? I think another thing that we don't engage enough in is listening to our community religious leaders. And regardless of faith, there are faith-based organizations that churches, mosques, synagogues, temples, they have individuals in their community that need support. And it's up to us to really reach out to them and say, how can we as a healthcare system, as a nurse, how can we support the people in your community? Because there is that fear. And I think, again, if we're not aware and we don't dispel that fear, these individuals are never going to get the care that they deserve.
I love that response. It's really incredible how you think through not just advocating for people in our community, but there's so many people in our community that are religiously affiliated who might
Absolutely.
feel that stress or tension going to a doctor, and being
Mhm.
able to provide some sort of action at that
Mhm.
level, I think is really important. As healthcare providers, obviously we want to play an active role in advocacy, but I think as part of that action that you mentioned, part of that is policy change. How are we advocating for that? So my question for you is, how as healthcare providers can we play a more active role in advocating for policy change to ensure equitable disaster preparedness or equitable response to communities that are marginalized?
This really goes along the lines of, again, not working in silos and not gatekeeping information. So if we do have communities that are telling us that, this is an issue that is impacting the individuals in their community, it really is up to us to take that message that they're telling us and share it by collaborating with, partners, having those interdisciplinary partnerships. We can't, as a healthcare in a healthcare system, truly understand what it's going to take to provide support for everyone if we don't have any skin in the game, so to speak, if we're not reaching out to those individuals. I truly think that healthcare professionals, especially nurses, really need to be involved in that policymaking process, not just by sharing the stories and ensuring that, frontline experiences are shared with our legislative officials, but really sharing it within even just our communities, because that those data driven decision making policies that come out really require us to share that information. So if we don't provide that information in the first place, our policymakers truly can't speak and advocate on behalf of the communities in which their constituents are. I think that is one of the biggest things that nurses can do is, again, have their ear to the ground by connecting with the community and sharing those stories with policymakers. One way to do that, besides collecting data, is fostering research or ongoing research and training programs. We briefly mentioned like community engagement with religious affiliates, but I think amplifying their voices and sharing their stories is going to be the way that people are going to understand the impact of the decisions that they are making. And I know that a decision that is impacting me may not be a decision that is impacting somebody else. It may be worse, it may be better, but unless we share those stories, we're never going to be able to change any policy for the better of everybody in this nation.
I completely agree. And, I think prior to us talking about the podcast and the recording, we had a conversation around the term burnout and how,
Mm-hmm.
it's so hard to say burnout because nurses have been burned out for so long and they're not advocating for themselves even, and they're not sharing their stories. So I'd love for you to kind of explain why you believe this label has been overemphasized recently, despite longstanding challenges in nursing. Why do you think the term burnout has become so popularized now? And how does this reflect the realities of nursing that we've been kind of facing over the last several years, or even before that?
Katharine, I think a lot of people are going to be upset with me, but I do have to say, I feel like burnout is a term that it is real. So let me just get the cat out of the bag. Burnout is real. I am not diminishing the fact that it is real, but I truly personally believe that burnout is now being used as a convenient label. And it's really shifting responsibility of nurses being burnt out to the individual nurse rather than addressing the changes and the issues systemic wide and the failures that have led us to feel this way. And I've been hearing more the term burnout since the pandemic happened, but I think that's also negating how people like me and my mentors have been feeling for 10, 15, 20, 30 plus years. We were burnt out before. We just found ways to, I don't want to say deal with it, because that's how we ended up being the way that we are. But I feel like the popularity of that term now is it's really just acknowledging that there are nurses' struggles, but it's minimizing everything else that led us to feel that we're struggling right now. And I don't need to toughen up or get more personal resilience. While resiliency is extremely important, I feel like we are going to continue to have the profession of nursing that is burnt out for years to come because we're not addressing that systemic crisis, that systemic issue. And that's truly what it is. Am I less of a nurse because I'm getting burnt out after 15 plus years in the ED all over the world, level 1 trauma centers to remote access areas? No, not at all. It just means that the impact of what is happening is affecting me. And I know it's not just me. I know it's nurses in general. But I don't like the term burnout as it pertains to, well, it's new, because it's been happening for years. Just we haven't done anything about it. Or we have tried, but not at a level that is garnering the change that we need. And I think that's what we need to address collectively, is those changes, those system-wide changes that we need to change so that in the future, we don't have nurses that are leaving the field.
Completely agree. I think part of the problem is really the fact that nurses are always advocating for others and not advocating for themselves to
So
have
true.
that change.
It's so
So
true.
it's just it can be really hard. I think part of the deeper systemic issue is that in and of itself. It's like we're so focused on others that we don't focus on the collective of the nurses who are having those burnout issues and have for years. So yeah, that's my 2 cents for that. I'd like to kind of pivot a little bit and talk a little bit about kind of disaster nursing and kind of how you deal with that with public health. So how do you see disaster nursing intersecting with public health, especially when it comes to planning and responding to large scale emergencies? I mean, we've seen so many in the last year, right? So how do you see those intersections?
I think that we focus a lot on disasters because disasters are sexy, so to speak, right? Like that's the big ticket thing that we see on TV. That's when you see people responding. But I would argue that disaster nursing and public health really are deeply interconnected. And if we don't focus on prevention strategies and response and recovery proactively, then that's why we're going to have issues by reacting to when the disaster actually happens. One of the things that I think, and I say this constantly, is, we're building resilient communities because we're investing in public health initiatives. So when we have public health providers that, are tracking and trending data changes as far as outbreaks or infections, they can minimize that risk by providing all the resources that, to manage that, to mitigate that disaster from actually happening. And so if we continue to invest in public health, we're not only building more resilient communities, we're decreasing the risk of a disaster actually happening. And this isn't just, public health, such as infectious diseases, but these also can pertain to like large scale disasters and emergencies. I think of, we just had a lot of hurricanes. And when we think of the hurricane, that's the disaster. But there are also public health issues that were happening that now kind of get diminished because now the initial response is going to be on that disaster, right? That hurricane. But that doesn't negate that people still need access to healthcare, or there's infectious diseases, for example, that, our public health and local state departments need to navigate and manage. It's just now buried because of that disaster. Whereas if we think of ways to provide access to care for individuals during a disaster, when that actual disaster does happen, we're already prepared. So being proactive is going to be so important. And I truly don't think we do enough of that. I really don't.
That's a great lead into my next question. So, I mean, with the increased frequency in global disasters, what advice do you have for healthcare systems or communities to better prepare and support, I think, nurses and clinicians really in these kind of unpredictable and, more, it's happening more often emergency scenarios?
You know, I think that if we continue to put our head in the sand and say, this disaster happened over there, it's not going to impact me, then we're truly not doing our due diligence as clinicians. And I'll even speak as a nurse to really be, again, that proactive rather than reactive. Preparedness doesn't just require, I have my PPE before I go into that patient's room. Preparedness really requires investment in infrastructure and training, and that workforce resilience. I can't stress enough the need for ongoing disaster education, mental health resources, especially for frontline workers. I feel like that is a taboo topic, or it makes it seem that nurses, again, aren't as resilient or aren't tough enough to handle the situation. But really, if we are proactive in investing in those resources for frontline staff, they're going to better be able to manage the disaster, and the provide care to individuals that are impacted by that disaster. I think additionally, that interoperability, working with EMS partners, I was a basic EMT, I was a paramedic, I was a flight nurse. having those relationships with the pre-hospital providers and our local healthcare systems, not just, where I'm working, but the other healthcare networks in our community to say, hey, if this disaster happened today, what do you need? What do I need? How do we mutually agree or come up with a plan so that if this did happen, we can take care of the patients and our own community? And I think that by us ignoring those disasters, we're not truly understanding the impact of what's going to happen, especially nurses, right? There's so much that we can do, but fostering that education as far as this disaster is happening, how do we work together? How do we be proactive? What are some gaps that we've identified? How do we mitigate those gaps? And this isn't hard. It just requires all of us to kind of sit at the same table and have those conversations with each other. And there really shouldn't be a reason why we're not having those conversations,
I like the idea of everyone sitting at the same table. I mean,
Absolutely.
I think we, as healthcare providers in general, don't do enough of that where everyone has a seat. And to be able to do that, even if it's, not just clinicians, but
Mhm.
administrators, to be able
Absolutely.
to communicate collaboratively and everyone have a seat at the table, I think would be really, really impactful. Just not just to emergencies, but in
Absolutely.
general, right? Um,
Absolutely.
as far as technology goes, with reshaping our responses to disaster scenarios, what type of innovations do you think will have the most significant impact on patient care or on clinical, we'll say burnout, right? Are there any innovations that you're seeing in that space?
I will say that technology is one of those topics that either you love it or you hate it or it scares you, right? I feel like we as nurses need to embrace and lean into the uses of technology, not just during emergencies, but during disasters. For example, we have people that are all over the world working in very unique settings that could impact their mental health. And we still want them to provide that care to the community, but we also want to support them in their mental health. We are able now to do that via telemedicine, right? Something very simple, such as telemedicine support. There's mobile health applications. I think technology is truly revolutionizing disaster nursing because there are AI predictive models. There are tools that enhance decision making. I mean, there are tools that tell us where a hotspot is as far as temperature wise, literally a hotspot in terms of the individuals that are overseas, for example, making pilgrimage, where that alerts the responders that there is a high temperature here. Perhaps we should go ahead and provide some extra water or sprinkle, some rain. These are some of the things that technology is helping us. There's also digital triage systems. There's also the opportunity to use technology in those low resource settings. Drones, for example, drones are a phenomenal way to kind of get a bird's eye view over a disaster scenario and truly say, well, this is what we are seeing. What resources can we get to that area? Or how do we take the images from the drone and find a way to, to evacuate those patients? And so these are the things that technology is helping us. We just have to kind of lean in. Now, I will say that not all technology is great. So, full disclaimer. But again, it's up to us to kind of do our due diligence and do the research and invest in technology that's not only going to better us in the future to do our job, but again, those communities in which we serve.
I'd like to ask another question about AI. I think there's a lot of fear in nursing and just in any clinical field that AI is going to take over our job. And you said something that I think is really important to point out is enhanced decision making.
Absolutely.
And I'd love for you to talk about like, hey, how AI can enhance decision making and how we can utilize it for the betterment of society as far as a public health perspective.
I think when we say enhanced decision making, we are often confusing that with, well, the robot is going to come in and can do my job more accurately than me in triage, right? But I'm thinking of enhanced decision making in regard to being proactive. So, for example, if there is a disaster that happened and we need to figure out how are we going to evacuate X amount of patients with Y diseases or Y issues to Z locations? How do we do that? That predictive modeling. What are some tools that maybe we're not thinking of? What are some things that maybe we're not considering in terms of evacuation or number of personnel needed, or equipment needed, or the return time? So when I think of public health preparedness as far as, advocating for technology for disasters, I think these are some of the things that we need to focus on rather than technology is going to take my job, right? I think it needs to be, well, I have all of these patients that I need to triage, and I did that, but who do I prioritize to evacuate first? Because I will tell you, while we can do this, when there are large scale MCIs, we have the need for technology to not only do it faster, but more efficient. And it takes that human element of, well, but this person is sicker or this person needs to go first. Again, it takes that element out of it, which is where I truly feel technology can be beneficial.
I absolutely agree with you. Along those same lines, what are you most hopeful for the future of nursing, and where do you kind of see your role evolving with that future?
I think that the healthcare system in general is at a crossroads. And I truly feel that we need to learn from our past so we don't continue to have the same issues. I think that the choices that we are making now are going to continue to shape our future, not just for what the role of nurses looks like, nursing in general, but really for the populations in which we serve, and the patients in which we care for. I will say that I hope to continue to use whatever voice that I have and I am able to not only stay engaged, but provide an advocacy voice, but also to speak up for those populations, because there really is power in collective action. I think that besides the bedside care, policy, which is very important, I'm not minimizing the care that, our bedside nurses provide, but I feel like that policy advocacy and the education, by sharing those experiences from those nurses at the bedside, for example, are truly going to help shape the healthcare system moving forward. I think that, there's a lot that we can do, and it's not that nursing as a profession isn't doing it. I just feel like there's so much more that can be done. I truly believe that there is an opportunity for nurses to continue to be one of the most trusted professions, and there's a reason for that. And it's because we take advantage of our opportunities to highlight what we're seeing, to advocate for not just the people in our community, but the people that are, marginalized or come from backgrounds where there is a fear or intimidation in seeking out care. Because at the end of the day, as a nurse, it doesn't really matter to me where you come from or what you look like. How am I making sure that I have at my hands able to provide you with the care that you need? And I think that if we collectively as a nursing profession continue to put that in our mind, then that's going to help change the entire landscape of nursing moving forward. And I hope that through opportunities like this, I'm able to continue to highlight all the changes that we need to make and collectively work with others that have the power to make it.
Very powerful message. I really appreciate you saying that. As a final wrap up, do you have one final piece of advice or something that you'd like to leave with our listeners as they kind of navigate the challenges and opportunities in healthcare today?
If I could just say one thing to everyone out there, is that nurses, you're not alone. I think that the struggles that you have, regardless of where you're working in the world, your stories are just as impactful as where you are as they are in any other country. And I think that if we could truly work together and stop working in silos and share those stories, we are so much more powerful together. I think that collectively, nurses, I am here, you are here. We truly want to amplify your voice for the better of the nursing profession and the communities in which we serve. So if I could just say one thing, I would say, please don't be afraid to reach out. Please don't be afraid to support another nurse. And please don't be afraid to share your experiences, because it matters. And until you do that, we're not going to be able to change.
Thank you so much, Jemla, for joining me on the podcast today. I've really loved all of your insight, and I appreciate you joining me and sharing all of your stories and insights.
Thank you so much, Katharine.
Thank you to all of our listeners for joining us on the podcast today. We appreciate your support. To hear from more healthcare voices like Jamla Rizek, hit the subscribe button and share this podcast with your friends and family. I'm your host, Katharine Cummings, and you just listened to Healthcare Voices.